We are truly honored because we have one of our own going to be the keynote speaker, Dr. Amitabh Shukla. He joined the club, I think, early this year, and then right behind that, we had the pandemic, so we didn't get to socialize much and get to know him. But I'm sure we are looking forward to that. With that, I want to say that Dr. Amitabh Shukla is board certified in adult neurology, as well as sleep medicine, vascular neurology, and EMG. After his training at Boston and Burlington, Vermont, he joined as assistant professor at neurology at Texas Tech University in Lubbock, Texas. In 1993, he moved to Houston as chief of neurology at McGregor Medical Center and served there until year 2000. In 2000, he started solo practice. It's a private solo practice, and Dr. Shukla is currently still practicing and enjoying in the areas served are Sugar Land and Richmond area. Dr. Shukla, as stroke director, started stroke program at Methodist Sugar Land and Oak Bend Medical Center, which both are certified by Joint Commission. On the personal side, he is involved in various community and medical organizations. He has 3 sons and 2 grandkids. And in addition to family activities, he is passionate about travel, music, and reading. I present to you Dr. Amitabh Shukla.
Thank you very much, Andy. That was a very nice and very kind introduction. I also want to thank Venu for helping me with the presentation today. It's one of the subjects which is very important, very relevant, and there is a lot of misunderstanding amongst certain terms like dementia or Alzheimer's disease, even amongst medical people. So hopefully in the next few minutes, I'll throw some light and that will be helpful. Alois Alzheimer was a German psychiatrist, a neuropathologist who in 1906 was following a patient with progressive memory loss, speech impediments, and delusional behavior. When the patient died, he did the neuropathological or brain tissue study. And then he started following those patients and described 4 distinctive changes in the brains of this patient. Those 4 changes are atrophy or loss of brain tissue, senile plaques, neurofibrillary tangles, and a granulovacular degeneration. This slide shows, on the left-hand side of the screen, what a healthy brain looks like, and on the right-hand side of the screen, shriveled up the advanced Alzheimer's brain will look. This is another example from a side view. If you compare the back side of the brain, which is on the left of the screen, to the front side, see the frontal and parietal area, how shriveled up and the loss of nutrition you see in those areas. The next 2-3 slides are manifestations of the plaques and the tangles, which show up in the brain. Basically, these are the unwanted visitors in your territory. Instead of a normal healthy brain cells, now your brain is dominated by these plaques and tangles. So according to the 2014 studies, there are about 5.2 million patients in the USA with Alzheimer's disease, and across the world, about 44 million. Unfortunately, these numbers are going to go exponentially high, and about 76 million patients in 2030 are expected to have Alzheimer's disease. So it will have a huge impact economically. It's the sixth leading cause of death in our country, and about 500,000 deaths per year are attributed to or related to Alzheimer's disease. From the diagnosis till death, there is about median survival of 3 to 12 years. The clinical spectrum of the Alzheimer's will change from very mild memory dysfunction, like, honey, where did I put my wallet, to extreme, which is where patient is bedbound or bedridden, unable to move, unable to talk, or having flexion deformities and having incontinence of urine or stool. So we use what is called FAST score or functional assessment staging tool, and it can give us the idea about what is the severity of a particular patient. So the term dementia is a descriptive term. Dementia is like saying somebody has fever. Fever is not a diagnosis. Fever due to pneumonia, fever due to UTI. So similarly, dementia is a descriptive term. Whenever there is an acquired or persistent compromise in the cognitive functions, where it is interfering with your daily activities, your social or occupational life, that is called dementia. Now, the words acquired and persistent are important because people with cerebral palsy or Down syndrome also have dementia, but that is congenital. They are born with it. Versus this is a highly functional individual who in the later half, develops this, cognitive dysfunction. And persistent is not like in response to a medication or alcohol, you have become confused or disoriented and then you recover. This is an ongoing chronic process. Memory loss is one of the hallmark of dementia, but memory loss alone is not needed. There are multiple domains of our cognitive function, executive planning, complex attention, visual spatial orientation, speech mobility, and some of those other areas will be included also in dementia along with the memory loss. So the common types of dementia are described in this, are shown in this slide. But if you look at the top two, the senile dementia and Alzheimer's dementia, together they are almost 95% of all the cases that we see. That is followed by vascular dementia. People who have multiple strokes or have high risk factors like diabetes or high blood pressure or cholesterol, they sometimes will also have what is called vascular dementia. The other terms that you may want to know, one is called Lewy body dementia, where there is a Parkinson's like tremors, and those are dominating along with the memory loss. The Parkinson's disease typically do have dementia as a part and parcel of their, clinical presentation. There are conditions like normal pressure hydrocephalus. Hydros means water, cephalon means brain. They have excessive water in the spinal fluid, in the brain. And with a simple procedure like putting a shunt, they can have a very improved outcome. And sometimes, in the next slide, we are going to see some of the other causes which are reversible causes for dementia. They include stroke, we talked about, infections related to HIV or tuberculosis can lead to dementia, toxicity, toxicity to heavy metals or certain medications, certain metabolic deficits like a vitamin B12 deficiency. These are the ones, if we identify, they are kind of a correctable, or at least there'll be some improvement if you address. And certain brain tumors can also be associated with dementia. If you have a systematic illness, it's like a kidney failure or a liver failure, sometimes cognitive dysfunction can be associated, which will look like Alzheimer's disease or dementia. But as the underlying disease condition improves, your cognitive ability may improve. So Alzheimer's disease is a chronic progressive disease which involves impairment of the cognitive function, speech, personality, and executive function. There's a strong family history. Almost 70% patients will have a positive family history. And there is a high association with head injuries. You may have heard about the NFL concussion settlement. There are a lot of cognitive abnormalities found with the football players who have taken multiple hits and head-on collisions. There's a high association with high blood pressure, heart attacks, depression in general population who will eventually can develop Alzheimer's disease. Again, do know there's a lot of things which we are learning as we are going along. Please, next, please. So we mentioned about the memory loss, which is a cornerstone for any dementia and definitely for Alzheimer's disease. Now, memory is a very important function. You know, our vision is on the back of our head, our speech is on the, frontal temporal region, but memory doesn't have one spot. Memory is all over the brain. There are billions of neurons and trillions of miles of uh, connections between these cells, which makes us, give the memory. Now, there are different types of memory. The short-term memory is the ability to grasp meaning, understand. Right now, I'm talking. You may want to remember that later on. You want to retrieve that. There's a short-term memory versus knowing what you are doing when 9/11 happened or when Kennedy was assassinated. That's your episodic memory. Semantic memory is the one which is meanings and concepts. If you read Wordsworth's daffodil, what it means. That's where we use the semantic memory. And the implicit memory, how to do things, use a fork or drive a car. Right now my implicit memory is in hands of Venu. But so those are different types of memories that we use. And depending on the stage of the disease, the person may just have a short-term memory. What did I eat for breakfast, or what did I have for dinner yesterday, or where did I put my key? Versus, in the advanced stages, almost all the aspects of memory can be affected. Associated with memory loss will be cognitive and executive aspect, focus, attention, planning, abstract thinking, conceptualizing, language. A lot of the times you will see there'll be a lot of or those type of injunctions which you'll see in the speech. Or when you want a hammer, you say, can you pass on that thing to me? uh, we all do that at times, but that may be the initial stages. When your language and your vocabulary starts suffering, one should be alert. If somebody points out, some good meaning person say points out, dad, you're doing that a lot, you may want to pay attention to that. And the third one important aspect is behavioral and psychological symptoms. Sometimes depression, suicidal ideation, social withdrawal, it goes like a 3 or 5 years before the actual Alzheimer's symptoms will come in. Also, paranoid behavior, accusatory behavior. For some reason, ladies, have this. They will hide their jewelry or money, and then they will say the caretaker took it, or daughter took it, something of that nature. So again, that is very common. Anxiety and delusions, and the hallucinations are very common. And in the advanced stages, especially with the males, sexually inappropriate behavior, exposure, or fondling, those are the things which can also be found. So there is a whole spectrum by which the disease presents itself. With the exception of mood, memory, and personality changes, neurologically there may be patient looking completely normal. However, in the very late stages, there may be weight loss and the flexion deformities, and if there is coexistent strokes or Parkinson's type features, those also will be available for the neurologist to evaluate. So we do several tests. Somebody with a memory loss comes in a doctor's office, neurologist. We routinely do this test. Now, these tests are not to confirm that you are old or you have Alzheimer's, but this is mainly to rule out other causes which can mimic Alzheimer's disease. So we do CAT scan or MRI of the brain, the CBC, the complete metabolic profile, vitamin B12, folic acid level, look for RPR, the syphilis test, HIV test, if it's relevant clinically, thyroid function, etc. EEG is a brainwave study, which is kind of a snapshot of how your brain is functioning. So it's a good baseline test to have. There are some higher tests. One is the amyloid, and I showed you the examples of the amyloid deposit. We have now a PET scan available that can detect the amyloid in the brain. There's a genetic test called ApoE4. However, for a test, to be important, there should be not only the sensitivity but the specificity of the test. And this test is not very specific. In other words, there are a lot of false positive and false negatives. So Medicare thought of that as an kind of experimental, and so it's not being paid by Medicare. And what Medicare doesn't pay, nobody else pays. So that is kind of, it's available, but it's not routinely done. In the next slide, I'll show you what the SPECT shows. in Alzheimer's patient. If you look at the colorful picture, the red areas in the front and in the parietal region of the brain, they show low metabolism of oxygen and glucose. So that hypometabolism is very characteristic of Alzheimer's patients. And all this is available. Typically, we don't need this type of testing for a routine patient, but when diagnosis is not very conclusive, we may utilize some of these measures. After diagnosing the Alzheimer's disease, what can we do? Unfortunately, as of today, 12/11/2020, we do not have any medication that cures Alzheimer's or controls the symptoms completely or slows down the progression. In 1996, we had first medication called donazepam or Aricept, and then that was followed by Exelon, Raminil, and Namenda. The sad part is that after 2003, no new medications have been, in the market, and the available the drugs, none of them, are 100% effective. We have over 25, 30 years of experience with these medications, so we sort of know that these are not helpful. These are all FDA approved drugs, and as long as the patient has functioning brain cells, these medications may be helpful. So if a stage comes where patient is very advanced, I don't particularly continue these medications. The common side effects are mainly nausea, vomiting, and stomach upset. Otherwise, it's generally well tolerated medications. Um, the There are no medications up to 2003, which is almost 17 years ago, is because a lot of research is being done, but under certain very powerful names, in the neuroscience research, the direction kind of got hijacked, and a lot of efforts were sent on a hypothesis, which unfortunately did not produce any conclusive results, for medications. So that's where we are. Hopefully, something will come in the next decade, but nobody knows. Um, there are a lot of snake oil salesmen out there on the Google, on your social media. Please be very careful. There are people selling the ginkgo alkaloids, vitamins, multivitamins, which are crystalloids versus mineraloids. There are the Pravagen, which is like a jellyfish extract. None of them are scientifically proven and should not be, used, on a routine basis. If there are significant behavioral or cognitive abnormalities, there are some non-pharmacological treatments which are very helpful. One is the emotional validation. It's no sense arguing with an Alzheimer's patient at 2 o'clock in the morning who is dressed up, with a suit and tie and with his briefcase, that, it's 2 o'clock in the morning and you retired 20 years ago. You just go with the flow. The massage, the acupuncture, the TENS unit, behavioral modifications, the token economics. If you behave this way, you will get this type of deal. All those things work. And environmental therapies like a pet therapy, music therapy. There are some Alzheimer's unit, they have wandering areas which are heavily monitored, with cameras, etc., where the patient is allowed to wander and enjoy himself. So all those things are, available. Of course, you'll need to have a special Alzheimer's unit. Routine nursing homes generally do not have this type of facilities. If there are depression, which is very severe depression, of course, is to be treated. In elderly population, do remember Alzheimer is a disease of elderly population. So these medications needs to be done, should be given very, very cautiously. I'm particularly not a very good fan of medications like Seroquel or Quietapine or Risperdal or Ativan. However, if person is really very agitated to the point that he can be harming his own self or family members, sometimes the judicious use of a small dose for a short period of time is allowed for Alzheimer's patients. Do remember that an ounce of prevention is better than a pound of treatment. And if you take one message out of my presentation today, is that whatever is good for the heart is good for the brain. So, uh, American Heart Association has a wonderful program called Life Simple 7. Control your blood pressure, control your diabetes, reduce the cholesterol, BMI less than 24, the body mass index or reduction of body weight. Um, Remove the unhealthy diet, red meat, excessive consumption of cheese and high fat substances or dairy or refined grains. Stop smoking, increase physical activity, and take precautions to reduce trauma to the brain, wearing helmets and safety precautions. If you have sleep apnea or poor sleep, you can improve your sleep. And if there is a depression, of course, it should be addressed. So these are the steps, which is not going to cure or get a complete, uh, uh, guarantee. However, it good thing about them is that there is no bad thing about that. There is no downside to it. All these are good, healthy steps should be incorporated in everybody's life. So we talked about, the future directions, where we are going to go. We talked about the amyloid plaques. For 2 decades, there were very big neuroscientists, they worked on enhancing the amyloid degradation or finding antibodies against production of amyloid or inhibiting the enzymes which were implicated in formation of amyloid. So there are that amyloid cascade theory is not holding. Similarly, the neurofibrillary tangles, the tau proteins, there are a lot of medications which are being studied for that. But as of today, we do not have any conclusive evidence that something is on the horizon. One of the things that I would like to share, I have many patients, but there is this lady, I'll call her Mary. She always comes with her husband for over 15, 16 years. She has progressed to the point that she doesn't know anything except I'm fine. So I always have this conversation with her, what is today's date, Mary? How are you feeling? Who is the president of the United States? So at the last visit, I pointed to her husband and I said, Mary, who is he? So she shrugged and smiled. So I persisted and I said, Mary, who is he? And not knowing his name, she smiled, looked at him very lovingly, and she could say, he's mine. So that is the only thing she remembers, that he is, something important in her life. So I'd like to end this by giving a salute to those unsung heroes. There are millions of family members and caretakers who are providing lots of care to these patients. Now, you mentioned about your knee or your back surgeries. There'll be a person who'll be taking care of you, and you'll be thanking them. These patients don't even know who is taking care of them. And yet, the daughters who bring them to my office and all the doctors' offices and all the family members and the sons who provide all this loving and caring for these patients, I think, it is something which is very important and very praiseworthy. So I guess I'm going to stop here. And if I have taken too much time, pardon me, but it's an important topic. So I wanted to make it as comprehensive as I could in a short time period. So any questions, let me know.
I was researching in the past, there was a link or suggested link, basically kind of the use it or lose it mentality, that those who stayed active mentally, playing chess and board games, and are you seeing that as well?
Yeah. So there, we talked about the cognitive abilities, and one of the important cognitive abilities, focus and attention. So this type of activities, they improve our focus and attention, and by doing so, indirectly they help with the memory. So, say for example, you go to doctor's office and the walls are green, and the doctor asks what the walls are. You say green, but your brain had already told you 30 minutes ago that the walls are green. but we don't pay attention, because it is not something important. Now, if the same approach or attitude percolates through everything that you do in our life, that we are not concerned, then we are less likely to remember. On the other hand, if we remain in the moment, if we put a lot of attention and focus, then the chances of our retrieving that memory will be enhanced. So crossword puzzles, Sudoku, these are all very good things to do. Because of the social media or some of the articles that are there are some patients, their family members, they become like a drill sergeant. That mother, now you do 30 minutes of crossword, now you do classical music appreciation. That backfires, because you cannot impose anybody to like something which they have not liked for their whole life. So we need to be innovative. Whatever music appreciation, you work in the yard, watering your plants, they are also equally important. Whatever the patient feels ownership and have a focus and interest and attention, I would encourage that.
My dad died of early Alzheimer's, but I don't know that he was effectively diagnosed. It might have been something we did on our own. But his maternal aunts and uncle also had something similar for a long time.
Mm-hmm.
And I think on my maternal grandfather's side, something similar. They had some sort of dementia. So me and my siblings are concerned that we saw a genetic component that could happen to us. And we're all feel pretty good. I run pretty well. So I was wondering, if I feel pretty good, I'm 66.
So, I mentioned about the ApoE4, allele test, that was a very big thing, big news in 2000s. And there were a lot of people, because it became available, there was an Athena lab which was doing that. And somebody is diagnosed with Alzheimer's, and their 35-year-old son or a 42-year-old daughter will go and get that test done. And unfortunately, if it comes back positive, for the next 40 years, they are going to live in that miserable state, where they may or may not develop the Alzheimer's disease, but their test was positive. So it raised some ethical issues. If you are not having symptoms, is there a test that sort of, seals the diagnosis? And there is, unfortunately, no test is available as of now. So I would not worry about it, because if there is a treatment, I would say go for it. But as of now, there is no treatment. So there is nothing that is. The game plan is not going to change, and you do not want to bring that anxiety and kind of fear, in your life. You don't have to worry. Just looking at you, I'm telling you don't have to worry about it.
Thanks. You haven't heard me speak.
I was wondering about stem cell research. Is there any application, or is anybody looking into that?
Good question. Everything, is being looked into, for the Alzheimer's, because, it is going to be such a humongous, somebody finds a cure or even a treatment which slows down the progression. There is going to be such a humongous, invention. So yes, it has been looked into, and there are no promising results as of now.
So I have a question. Do you know of any clinic or any medical facility in the Houston area where you can get a SPECT scan? I know they do them in all the Amen clinics around the country.
Yeah, so any neurologist can order the SPECT scan. Your insurance may or may not pay for it. Similarly, the amyloid scan, at Methodist, at St. Luke's, and Memorial, all the medical center, they do have the amyloid scans are also available. That gooey substance that get deposited in the brain of Alzheimer's patient. and there is a way of demonstrating that. So all this is available. The tau proteins in the spinal tap or CSF is also available. So if somebody, after the routine screening tests are done, if somebody wants to go further to advanced stage of testing, that would include the ApoE, the genetic type, which shows the predisposition for Alzheimer's, PET scan with the amyloid or the SPECT scan. And then some patients, we do what is called neuropsychological report, especially if there are some legalities involved with the big estate and the family feud. Then, whether like a competency measurement of the patient, whether he is able to take a good decision regarding his will and estate, etc. So those are the things I would say. If I see 100 patients with Alzheimer's or other form dementia, we would be employing this less than 2 to 3%, because it's not generally needed. But to answer your question, yes, you can do that. Methodist Neurological Institution has an Alzheimer's and memory disorder clinic in the medical center area. So, and I think Rachel Doody, Doody, she is the director there. And, but by going there, it's not a guarantee that, all these tests will be done, because, they will do the basic and they will explain, what is available. And I mean, what is the scenario?
Thank you very much. Appreciate it.
Yeah, I've encountered some patients with dementia that if you sing to them, if they're singing, they actually, it's almost like the dementia goes away, and they actually will have conversations, of course, about the past, but very coherent conversations. And it seems that the music triggers it.
So music therapy is very, very important and very supportive measure. It doesn't cure dementia for sure, but it sort of rekindles our brain cells. And also what happens is, along with the rekindling, other memories will come out. And I don't want to take too much time, but I'll just give you an example. Say, there is a young couple, recently married, money is tight, and, a lot of stress is going on. It's a Sunday afternoon, the husband is watching game and say, honey, give me a beer. And she said, why don't you do it yourself? And, one thing leads to another. And then in the process of heat, he slaps her. Okay. And then if he feels it's a bad thing, he apologizes. Fast forward 20 years, the lady has gone to school, picked up the grandchildren, has gone to Kroger, picked up her grocery, and then she's in the car. Now she starts the car and radio starts playing. And lo and behold, the same song is playing where Bill had hit her, 30 years, 20 years ago. Okay. What is going to happen? The entire scene, including what shirt he was wearing, is going to come in her memory. Because somewhere that song that nobody was listening, which was playing in the background, was there, in her memory, etched forever. Does it make sense? So when she listens to this song now she sees the whole memory that comes back. So that is called sensory rekindling. And when you have those sensory rekindling, then there are a lot of memories and emotions which are attached with that music that comes back. I think some months ago, somebody had sent on a social media, very nice and retired ballerina. She's like I do not know whether you saw it or not. It was a very heartwarming thing. She doesn't know anything, but with certain notes, I think, it was a swan, and she will make certain gestures, that will exactly coordinate with the music. So yes, music has a very powerful role, but I would not go to the extent that it cures dementia. I'll encourage that. I hope it helps, answers your question. Very good. Good questions. I'm happy that everybody is asking this question. So, okay,
Doctor,
anything else?
Yes.
Yes,
Doctor,
go ahead.
Are there natural foods that can help be as preventative? For example, like nuts. I've read in health magazines.
Yeah.
Small amount of nuts
So
today.
there is no dietary recommendation by American Association of Neurology, but the closest the diet which is good, because remember I told you whatever is good for heart is good for the brain.
Yes.
So there are two diets I would like to mention. One is called DASH, DASH, which is a diet for atheromatous changes and high blood pressure. It's a salt-restricted diet. And then another one is the Mediterranean diet, where it doesn't have much of red meat. It has some fish. It's mainly, plant-based with a lot of healthy nuts and healthy fats. So the Mediterranean diet or the DASH diet, although there is no official position of recommending, those are the two that are the closest I would recommend. At your age, if somebody's 80 years old, probably no diet is going to make any game change there.
Thank you, Doctor. Great presentation.
Good. Very good. Well, thank you very much for giving me this opportunity, unless there are any other questions. And I really enjoyed this exchange. And sorry for the little interruption in between.
Oh, thank you so much, Amitabh. That was very insightful.
Thank you.
Very. Anytime you have a lot of questions, that means that people were very interested in the topic, and that you were speaking to a topic that folks wanted the information about.